I'm going to talk a little bit about social prescribing, as it may be a new concept to some of you, and we'll certainly talk about art pharmacy. But before I do, I just want to share, and I think you all probably know that Mass Cultural Council is not a leader. Mass Cultural Council is the leader in advancing social prescribing from a state agency standpoint across the country. It is just remarkable the work that you all have done over these last few years to lay the groundwork for this to be possible. Social prescribing is coming to the United States. It is an inevitability, and Massachusetts should be proud to have paved the way. So I'm going to share my screen and go through just about a 8-minute presentation, and we'll leave a couple minutes for questions and answers at the end. So briefly, Art Pharmacy, we are based in Atlanta, Georgia. We've been working with health systems and payers to increase access to mental health services for about 2 years now, since early 2022. And as you all are well aware, there's a youth mental health crisis in America. It was bad before the pandemic, with suicides up 57% prior to COVID-19, and it's been exacerbated since. 1 in 5 children and adolescents have reported a mental or behavioral health disorder. 4.8 million adolescents had a major depressive disorder in 2022, and we know that marginalized young people are especially affected. In addition to the mental health crisis, many of us learned earlier this year about the social isolation and loneliness epidemic from the US Surgeon General, with loneliness in the United States posing risks as deadly as smoking up to 15 cigarettes a day, costing the healthcare industry billions of dollars annually. With the national crisis comes regulatory pressure. Although the most severe cases tend to make the news, there's an enormous population need and not the available network of providers. While health plans and health systems are getting much of the bad press, there are systemic issues beyond their control that have created this problem. More than 40% of adolescents with a prior year major depressive disorder, this was last year, that's 2.1 million people, did not receive mental health treatment last year. So now that we're sort of clear about part of the problem, we talk about social prescribing. Social prescribing is an evidence-based approach. 40 plus years of research at Hopkins, Duke, Harvard, the World Health Organization tell us that engagement with arts and culture can reduce anxiety, depression, and social isolation. Social prescribing is now transforming how we care for mental and behavioral health needs. It's built on the biopsychosocial approach that people really love. Social prescribing is also a way of putting economic resources back into the local communities of culturally accessible providers. So Art Pharmacy is a turnkey, end-to-end curated network of therapeutic experiences that patients want to engage with. We give members access to arts and culture engagements that not only have protective and therapeutic benefits to their health, but that people actually choose to do. Many times people, compliance with antidepressants, SSRIs, or even psychotherapy is really low. These are things that people want to do. We are the first fully integrated, comprehensive solution for social prescribing in the United States. This includes a closed loop referral system, care plan integration, and outcomes monitoring to drive adherence and utilization of the right level of care. We personalize each member's engagements to their wants and needs using a carefully curated offerings of arts and culture activities. This is precision medicine for behavioral health. For the healthcare nerds on the call, it fits fully into the medical loss ratio. Payers and health systems across the country are now using Art Pharmacy to deliver the benefits of social prescribing to their members. We have some fantastic partners and very excited about those growing in Massachusetts. So I want to talk about what it looks like from a member or patient journey. So we'll use Dolores' story to talk about how it works. Meet Dolores. She is 67, struggles with social isolation, exacerbated by one of her good friends recently moving away. So here's how it works. Dolores goes about her care, as she always does. However, at this checkup with her primary care provider, she mentions her struggle with isolation. Since Dolores brought up her social isolation. A referral was made to our pharmacy where she is connected with a specialized care navigator. This is the link worker in most social prescribing models. In this case, her primary care navigator made the referral, but we received referrals from a number of different types of practices and specialties, from behavioral health and oncology to palliative care and school-based providers. When reviewing the referral and medical records that were sent over to our pharmacy, our care navigator noticed that Dolores also has a diagnosis of type 2 diabetes. Using our smart matching technology to make personalized recommendations for arts and culture engagements with protective and therapeutic benefits for mental health and in coordination with other treatment plans, we generated a customized dose cycle. From there, the art pharmacy care continuum is comprehensive. It covers coordinating logistical needs, sending reminders, follow up on each engagement, regular well-being checks. We measure the patient progress and provide that data back to the referring provider to assist with the monitoring outside the clinical setting. The care navigator walks Dolores through every part of the journey from beginning to end, and if a refill is needed, the care navigator will stay with Dolores into her next cycle. So as you can imagine, in order to meet such a wide range of needs, the arts and culture offerings naturally cover an extensive range of factors. We already have a network of more than 300 enrolled arts and culture partners in Massachusetts. The Mass Cultural Council team has played a critical role in that. Michael, Beth Ann, Eric, Kata have been wonderful partners to us these last several months, connecting with arts organizations as well as partners in the healthcare community. We are thinking about the range of artistic disciplines and subgenres, the modes of delivery, whether it's in person, virtual, or by phone, for those that have both tech access and are homebound. The types of experiences, participatory experiences, receptive experiences, and then, of course, the cultural relevance and cultural accessibility of the offerings. The size of the partner organizations, we work with large institutions and community-based organizations. It's very important to really meet that patient where they are. Because we have comprehensive offerings and engagements, most patients communicate our services within their social sphere. This creates, sort of a word of mouth buzz for other members of the community to seek out how to participate. Certainly don't need to tell anybody on this call, but the structural barriers for individuals accessing care are real. And this is why we're very focused on ensuring that our engagement with members is cutting through these inequities where possible. We want to move the needle for individuals and our healthcare partners. By reducing emergency room visits and improving members' health, we've seen great adherence rates, more than double that of antidepressants, and a 22% improvement in patient well-being as measured by the WHO-5, which is a validated well-being index. So I'll pause there, leave a couple of minutes for questions if you all have them. I'll drop my contact info in the chat. We would welcome your feedback, connections, partnerships as we launch in Massachusetts. The continued advocacy with Mass Health, their state legislators, and both the nonprofit and private healthcare sector are vital to the continued growth of social prescribing in Massachusetts.